Defining competencies. Anybody in medical education today will have heard about the core competencies, the competencies. So I wanted to just define what a competency is and where it came from. Because competencies are in place to make objectives and standards explicit, to state them out, to list them, to make it easy to understand. So competencies developed out of the outcome movement. We wanted to start looking at the outcomes of medical education. Our goal is to train a physician. And in training a physician, there are specific knowledge, skills, and attitudes that they need. The educational goals in an outcome for a core competency needs to be broken down to its component parts, with each component taught, learned, and evaluated to confirm that the student learning it has acquired the skill we're talking about. So competencies make the foundation of physician education standard and consistent between anybody given the title physician, osteopathic physician, or doctor. The common knowledge and skill levels that we want our students to have before they can call themselves physician are called the core competencies. And generally, competencies are stated in behavioral terms. And this is meant to make medical education more formal and more accessible. And it also allows for the assessment of both the learner and the training program. So competencies are giving us a way to prove that student physicians are learning the necessary skills to be physicians. It makes medical education all about learning, not about teaching. It's not how long you spent in a program, but have you acquired the skills you need. In undergraduate medical education, we moved a long time ago from apprenticeship to a curriculum-driven education model. Graduate medical education lagged pretty far behind. And up until 2001, graduate medical education really was still in an apprentice model. You still learned by following. You learned by seeing what other people did. And in order to make graduate medical education more standard, and in order to list the expectations of trainees and make that information explicit, the competencies were developed. They state the objective skills, knowledge, and behaviors that a student physician needs to have before being allowed to perform independently as a physician. So in conclusion, we have 7 core competencies in osteopathic medicine, starting from osteopathic philosophy and osteopathic manipulative medicine to medical knowledge, patient care, interpersonal and communication skills, professionalism, practice-based learning and improvement, and systems-based practice. Once a student can show that they have mastered those competencies, they've shown they have the knowledge, skills, and attitudes to become a physician.